Welcome, everyone. Thank you so much for joining the World Affairs Council of Connecticut. We're so glad you can join us today to discuss tech, privacy, and bias in the COVID era. We have a very special guest today, Dr. Nicol Turner-Lee, Senior Fellow and Director of the Center for Technology Innovation at the Brookings Institution and Co-Editor-in-Chief of TechTank. Thanks so much for joining us, Dr. Turner-Lee.
Thanks for having me.
So today's structure will kick off with a conversation with Nicol Turner-Lee and Megan Torrey, CEO of the World Affairs Council of Connecticut. Dr. Nicol Turner-Lee is a Senior Fellow in Governance Studies and the Director of the Center for Technology Innovations at the Brookings Institution. Additionally, she is the Co-Editor-in-Chief of TechTank, which has just released a new podcast that we highly recommend you check out. Dr. Turner-Lee researches public policy designed to enable equitable access to technology across the U.S. and to harness its power to create change in communities across the world. She is an expert on the intersection of race, wealth, and technology within the context of civic engagement, criminal justice, and economic development. Prior roles include as Vice President and Chief Research and Policy Officer at the Multicultural Media, Telecom, and Internet Council, and as Vice President and the first Director of the Media and Technology Institute at the Joint Center for the Political and Economic Studies. Dr. Turner-Lee's recent work is focused on addressing biases in machine learning algorithms and the digital divide, 5G mobile infrastructure, and telehealth. She's written extensively on the digital divide in both urban and rural areas and the availability of local health resources, including those enabled through telemedicine. So her forthcoming book on the topic is called Digitally Invisible: How the Internet is Creating the New Underclass. So now let's just get started. I'm pleased to turn it over to you, Megan Torrey, CEO of the World Affairs Council.
Thanks, Amanda, and thanks everyone for joining us. Dr. Turner-Lee, we are so excited to have you with us today. We've been looking forward to this conversation. I know we're going to talk a little bit about tech and COVID and health, but can you just sort of start from the beginning? Tell us, what you're doing at the Center for Technology Innovation in Brookings and at TechTank, sort of set the stage.
Yeah, no, first and foremost, Megan, thanks for having me, Amanda, for those kind words. And hello, Connecticut. I'm actually a New York girl. I grew up in New Rochelle, New York, right on the border of Connecticut. So it's always great to do stuff on the East Coast, particularly with an area. In fact, my book that Amanda referenced, I went to Hartford, Connecticut, and actually took some time to spend, some research time there with the men and women who are actually trying to accelerate broadband in that state. So why am I here? And just give you a quick few moments. I mean, I've been around. I know I don't look like it. I was just telling the ladies, I'm so happy I get to wear my red earrings today because I haven't figured out the right outfit. But, I'm all about tech policy and digital inclusion in particular, and how we close the American digital divide. It's no secret that COVID has sort of exacerbated and amplified those inequalities, and that being connected really matters right now. And because it matters in so many ways, from education to healthcare to employment to access to government services, we have to figure out how to make it work. So as it was suggested, I work on those types of regulatory and legislative issues surrounding how we make broadband available to everyone. And then I also, as if I don't do enough, right? I was listening to my bio and sort of getting exhausted, is I also work on artificial intelligence, because the future of tech is actually in machines and robots and automation. So happy to be here.
So excited to hear that you were here in Hartford, which is where I'm sitting. And as you know, the city is working so hard to make access equitable. So we are definitely going to have you back when that book comes out for a book talk. So let's talk a little bit about where we are sitting today, right? We know that the coronavirus has sort of ushered in this new era of looking at digital contact tracing, technology in health, artificial intelligence. Can you describe some of the tech tools that that we're talking about today when we're looking at health and tech?
Yeah, it's so interesting because I'll date myself a little bit. So I've always had an interest in the use of technology for healthcare. Dating back to almost 20 years ago when I was getting my PhD in Chicago, I realized that there were people that just did not have sufficient access to quality care institutions. There was not a local hospital that was in close proximity to affordable housing development. Then rural communities, you had to drive 10, 15, 20 miles in some cases to get to a local hospital. I kid you not, maybe back in early 2000s, I actually saw the first demonstration of telehealth in Anchorage, Alaska, where we were with a group of legislators at the time. I was in a previous job, but we got to see what dermatological care looked like from the hub of the Anchorage to the islands off of the coast of Alaska. And so I've been a big fan of using technology to actually make these things work. And what's so interesting, since I saw that first, pilot, is that technology has evolved so quickly that we actually could do other cool things, right? So some of us may remember, doctors using Skype as the primary contact to get in there. Now we have FaceTime, where doctors can actually FaceTime patients when it comes to critical care. And what COVID actually did is it actually told us or suggested that we needed to physically distance in ways to, one, mitigate the risk of community spread, but also ensure that people who were older or had extensive medical conditions prior to this virus erupting were in a state where they could actually be less vulnerable to external influences. So now, even my dear mother, who sits in New Rochelle still, actually uses telehealth. She's finally figured out how to turn her phone the right way so the doctor can see her versus looking at her wall. But it's so transformative in terms of what we're actually seeing around the use of these types of services, particularly as we mitigate a huge public health concern. It really is about trying ways to be creative and sort of reimagining healthcare so that we can keep people safe.
So we've seen, examples from around the world about apps and contact tracing, proximity tracing, using our phones to sort of, identify, who has COVID, who's at risk. Can you talk a little bit about how some of those technologies are being deployed globally?
Yeah, so interesting. So I think Korea was one of the first countries to actually deploy digital contact tracing. And for those of you that are unfamiliar, it's not necessarily that the app world is sort of scraping your individual data. It's actually using beacons, and it's beacons that are voluntarily opted into in terms of a person downloading a particular software onto their phone. And it's peculiar as well as very interesting to me, right? This beacon sort of picks up if you have been infected by the virus or exposed to somebody with the virus, and it literally acts as a social network to contact the people within your circle that they need to contact a medical public health supervisor or a public health entity. That has been used in ways, I think, overseas that is very different from how we use it here. So let me start with overseas. So there are places in China and Korea and other places where people actually have a marker to actually indicate their participation in this program. And in this country, in the United States, those types of surveillance technologies are a little bit invasive and obviously to many very creepy when it comes to that. I think we have a challenge, and I know a couple of people because obviously African Americans are disproportionately impacted by COVID, so it's not unlikely that I know several people, including those in my family who have passed away or been infected, that people who are vulnerable are not necessarily going to want to call their public health official and say, I have COVID, given the trust factors related to healthcare. But it is an interesting way to sort of track the spread of the disease and to contain it. It's much like the HIV initiative, HIV public health crisis, where we needed that type of contact tracing and public health surveillance to limit that. The really scary thing about COVID, in all honesty, is that it has various peak points that we're not clear within the digital contact tracing life cycle, that, a person is, immune one day and not immune. I could give you a perfect example. I have a son who just went to college. He had to have a negative COVID result. I ended up taking the test as well, but then we thought about it. His test result today doesn't necessarily mean that he's completely healthy within the 14-day incubation period. So those tools, I think, are going to facilitate our ability to keep track of the virus and to potentially offer the type of human support that is necessary to, reduce community spread. But they also come, particularly in the United States, with a host of risk around bias for particular communities that are disproportionately impacted by the disease. They also come with privacy concerns of what happens to your data as you participate. Companies have told us, for example, that they don't really want your data to go beyond the public health agency, but we know government has the tendency to sneak and to look and to surveil. So we don't know if that's going to be an issue. And we also don't know if the data that's collected during digital contact tracing will be used by health insurance companies later to make determinations around eligibility or, your well-being. So there's a lot of questions and concerns that we have in the United States, which is why I think, Megan, we've not seen a very widespread deployment of the technology. And we've seen more, pen and paper and manpower actually going out there and doing the physical contact tracing.
So let me ask you this. Do you think that the integration of new technology tools, would be making a bigger impact in combating the disease?
Oh, absolutely. Yeah, absolutely. I mean, that the thing that we know about technology, and for people who follow technology, it's always been a way to level set the type of innovation and the type of problem solving that we as humans often don't have the capacity to do. I mean, the coolest thing about artificial intelligence is that a computer can actually, in milliseconds, come up with determinations that we may not have. And in the healthcare space, it's particularly interesting because technologies can sort of help us detect disease as well as help us in the creation of cure. But the challenge is technology doesn't sort of walk on its own 2 feet and come up and, become all of a sudden divorced from society, right? It comes with a set of values and assumptions and norms of the people who create it. And so I think we still have to be very mindful that it's not necessarily that we want to stifle innovation, but there are some, potential risks that come with deploying a technology in a very flawed world. And so I think, going forward, that's something that we have to keep talking about.
So I want to ask you a little bit about those concerns. How should we, as the public, should we be concerned about privacy intrusion and how some of that data might be used?
Yeah, I mean, it's interesting when you talk to the major companies like a Google or Apple that are putting these applications together, they're really asserting at the top level that they're not interested in taking people's private data. They are the device that shoots off the beacon that allows for iOS and Android compatibility. But we have had in this country, the last several years, real big public concerns about online safety. And in the absence of a federal privacy standard, unlike other countries like the EU that has a federal a governance structure in terms of managing privacy through the general data protection rules, we don't have that here. And so what's been happening is that we've actually seen more regional state coordination. So I was part of a conversation, for example, in the DMV, where you have DC, Maryland, Virginia sort of coming up with their own privacy guardrails when it comes to the type of regional contract tracing, because there's a particular interest in mobility. I'll be talking soon, I think, to the people in Carnegie Mellon that have been focused on location tracking of the virus. In all of those technologies, there's a genie in the bottle somewhere. And that's the work that I do. I try to find the genie in the bottle. I'm like that person on the beach with the metal detector. And I'm like, oh yeah, there's bias, oh, potential of discrimination, right? And so it's really important as we actually develop, design, execute these models that we have checkpoints throughout the whole process to ensure that we're not creating more harm and more risk, particularly to vulnerable populations.
Let's talk about that bias. What are some of the inherent biases in these tech tools? The algorithms, the strategies, what's going on?
It's so interesting. So I was on a call yesterday, and I had heard this really startling statistic about African Americans having COVID as like the third most likely reason that they would die. And that is now up there with chronic disease, diabetes, and a host of other medical conditions that come with people who are often exposed to poor food choices, right, by the neighborhoods that they live in, density in population, and the types of jobs that they have. And Latinos come not too far off from the third. So when you look at that, we know that we're going to come out of this pandemic sort of with that fence around these communities in terms of who has the higher likelihood of being infected. Those make determinations with our medical institutions, not necessarily our doctors who have been our heroes, and our nurses and our home healthcare aides and people who are in the business of taking care of us, but they impact those that have to make decisions around our risk when it comes to healthcare. So a bias that could potentially show up is that data is harnessed at the end of this or somewhere in between this to place higher risk scores on those folks that have a higher likelihood or characteristic trait of being infected. You have that issue. You have the issue of that data being available. And we've actually seen this, like in Congress has been sort of looking at this, deceptive, get well quick, get your COVID test, swab your mouth and put it in an envelope and it'll come back and tell you you're sick or not, right? We have that in terms of the vulnerability of those communities. Then we also have, the potential of bias in the design, the assumptions that come with knowing that one group or the other. And that's the really, and I know it's not the place for it, but I want to be really transparent. This virus has been politicized. And it came within the context of the shooting of George Floyd, an African-American unarmed man, or the death of George Floyd. I was thinking about other people that have been shot. And when you start to think about the contextualization of this virus among all these other things, high rates of unemployment, insufficient access to the type of healthcare resources needed to fight the virus, the inability to open schools, this will come with certain political assumptions, right, Megan, as well as certain assumptions around particular protected groups. So those biases will show up in the models. Right now, there's not a high representation of diversity among women and people of color in these in machine learning design and data science. And on the flip side, there's not a lot of feedback being taken from us as consumers as to whether or not this is who we are on the internet. And so this opacity of the internet, along with the volumes of data that we have all contributed in the last few months, I think is going to implode, particularly if we don't have a federal standard that tells people what's on and off, limits when it comes to our personal information.
You mentioned that you're working with some institutions, with some companies to address these biases. So how is that being done? What are some of the tools that we can use? How do we sort of help ensure that those biases are, aren't in that data?
I was on a panel yesterday with NIST, who is the federal agency responsible for standards and for testing. The first thing that I say to people is that we have to acknowledge that it exists. If you just sort of start there, then we know that the technology is just as fallible as we are as human beings. And if we acknowledge that those biases exist, the second thing that we need to do is to acknowledge that the systems that are in place, and I'm a sociologist studying tech, so you understand my reason for saying this, is that we have flawed structural systems that have contributed to the over-incarceration, the increased health disparities, the limitations in access to education and broadband, that in some way will seep into the broader context of the way these technologies are contextualized and where they're deployed. And if you start there, you at least go into this modeling, right, as an engineer, as a computer scientist that doesn't have a lot of exposure to people, and you can at least suggest to yourself or propose to yourself, I need to develop this in ways that are diverse and inclusive and equitable in its design, and be prepared for those instances where it will break. I mean, the tech community, Megan, has long operated off of, break it now and fix it later, right? I tell people, like, they're operating on permissionless forgiveness. I'm sorry I took your data. I'm sorry that we tried to steer the election. I'm sorry that I didn't know too much about you in the design of my algorithm or the design of my model. I'm sorry that I didn't know that, 18 million people in this country are offline, so they can't even benefit from the things that are happening right now in the pandemic. And I think we need tech companies and other developers and designers of these types of systems to think more proactively and bring people in, open up the table so there are more seats, so that we can actually design and develop products that are much more representative of the world in which we live. Right now, when you think about what's happening during this pandemic, and I've been doing this stuff for like 25 years, digital access is always, first and foremost, there's always been a digital divide. It's been decades that we've known that. Dating back to the early 2000s, the Department of Commerce identified through this report, Falling Through the Net, in the early 2000s, that we had a digital divide. That's where the term came from. And now, we now see that there is now some kind of exit or obliteration of an analog society. Just look around your communities. The businesses that are closing are those that were not resilient enough to compete against an Amazon or to, convert to an online platform. And so we have to now take this seriously, because it's impacting the way that we increase, our economic and social trajectories, but also improve our quality of lives.
So I want to encourage anyone listening in the audience to use the Q&A feature to ask Dr. Turner-Lee a question. But I do want to start with one from the audience. Do you think some of these privacy concerns are, solely a U.S. national issue, or do you think there should be a global standard for sort of handling health data?
There should be a global standard, but, unfortunately, the EU has come out the box. The EU announced their General Data Protection Rules, GDPR, last year, but they were 6 years in the making. The United States has always had starts and stops when it comes to federal privacy legislation. And China, which is another major player in this space, has basically said, we'll just fence everybody out to have our own privacy and do the things that we want. So ideally, there should be cooperation and collaboration about that. Honestly, I think, to the person who asked the question, we need global standards that include health around governance of the internet. And that's a conversation that we have yet to have when it comes to, How do we handle these big pockets of data that are much more portable? And then two, how do we handle the civil and human rights aspects of those pieces of what we care about? In the United States, we always have had HIPAA. And so the idea is that HIPAA will still apply to the collection of health data. In fact, under telemedicine and telehealth, those standards still apply. Where they are a little bit murky is when we get to digital health, like Fitbits and other things that are not necessarily prescribed by your doctor. But we do need a federal privacy standard in the United States. And the United States used to be a leader in that. My colleague, Cam Carey, is working on that. If you want to read more about federal privacy legislation, go to the Brookings website. We got a 1,000-page report of the legislative drafts that have yet to be resolved on there. And with a new election coming up, there's a possibility that we may go towards a national standard. But the key thing is there's too much happening in the world around technology for us not to have it. And healthcare is one of those areas that we should really be clear, is it a covered and protected standard, or is it something that we're going to leave the marketplace to sort of define for us?
So I want to ask a question from one of my World Affairs Council colleagues from another council. Has there been any gathering, any coalescence of power, activists, political, to sort of force big tech into solutions that would benefit more people?
Well, they tried to do it at the congressional hearing a couple weeks ago, where we had the CEOs of Apple and Google and Facebook, and Amazon all on the same screen. We've never seen that before. I've been in Washington, D.C. for like most of my life. And we've not seen these companies come to Washington, D.C. to be interrogated, because it is hard, right? So they had it easy, except a couple of them. I think that what is going to happen, and if you are interested in terms of how this actually relates to election, we just put out a piece again at Brookings. You can go to brookings.edu, or you go right to my expert page, Nicol Turner Lee, and you'll see all the stuff that I've been working on. I think that there will be some strong arming of big tech to be responsible. And I think that there'll be this mixed message, in all honesty. I was just telling this to somebody, because tech has essentially helped us live and survive. Facebook has allowed us to stay in touch with our family and friends. Amazon has allowed us to get products and services during this time of social distancing. Google has allowed us to look for the resources that we need when it comes to self-diagnosis of COVID. I can go on and on and on and on. But our love-hate relationship is when those companies are irresponsible with our data, they're irresponsible with our, they're anti-competitive, and they push the acquisition of companies that leave the little guy out or the little lady out. And so I think going forward, we're going to see that kind of pressure and stress. But I want to advise everybody, we're 4 months out of an election process. And so I don't think a lot's going to happen in terms of forcing any type of regulation or any type of review, merger and acquisition review. I think if anything, tech is going to try and stay on the side of who they think on both sides, so that they're in good standing with either one in case of the output. But we definitely have to have a conversation going forward about enforcement and acceptable practices, and what tech needs to do to be a democratic partner on those issues that go above the line of what they actually do. These companies are doing much more than social networking, right? And I think that's where legislators and people like us sort of trigger it when we see companies going into spaces that were previously litigated, like voting or election campaigns, is where we're going to actually see above the line enforcement.
So you've been writing a lot about sort of technology policy in maybe the potential next administration, whatever that administration might be, whether it's a Biden 1 or a Trump 2. What are some of the things that you would like to see when we're looking at sort of developing a comprehensive technology policy?
Well, I'm just like a think tank person. I got a story for that, right? Go to the blog. We just actually published a piece on a Biden-Harris ticket, and we're about to actually do a piece on what any administration, whichever side gets elected, should be looking at. I think first and foremost, like the previous question, it clearly has to be a conversation on what we do with big tech, and what do we do with big tech to open up opportunities for small businesses that need to come into this space. Because again, as you walk around your communities, it's very clear that businesses that were not resilient enough to survive this COVID pandemic have closed because they could not convert into an online model. Restaurants are a great example of that. Hospitality industry is a great example of that. So I think there'll be a focus there. I think the other thing that is glaringly obvious is that we do not have a national strategy for closing the digital divide. 53 million kids went home on March, And probably the same amount of kids that went home in March are still at home. Now they're actually going virtual, and we have an equity issue. So it's really important for this next administration to get past the politics and stop making this an issue about masks and making the issue of laptops similar to ventilators. We must keep kids connected to learning. And that I think is very important. It's not just about whether or not they can go online and see their teacher. It's about their access to food, their access to healthcare, their access to supportive services, special education, the right type of discipline. And so we've got to figure out ways to have a strategy for this next administration to ensure universal broadband access, even if that means maybe revamping how we think of universal access to the state. Third, I think it's important on the conversation we're having, Megan, that we think carefully about the role of artificial intelligence in our society. Is it done for the public good, or is it done to weaponize certain communities, or is it an issue of national security? Obviously, China is an issue for us, and we need to figure out what that looks like. And I would suggest another bullet, because I've got about a list of 10, but I'm gonna keep it like a preacher and keep it to about 4. I think looking at the conversation around healthcare is particularly important. Today, the administration put out the president's support of telehealth. I think that is excellent. And you often don't see me say excellent in the same breath as this administration. I'm quite honest about it, because it's been a lot of work. A lot of work for a think tank person. I am so exhausted. We normally take a little bit of time off for the summer. It has not happened, right? But part of the excitement about telehealth is that it's taken 10 years for us to get ourselves out the way in terms of looking at medical reimbursement and interoperable and interstate, data sharing. Having a portable, sustainable, long-term telehealth strategy will benefit millions. And I think that's something that even will be incentivize doctors. We just did a paper about this a couple of months ago to actually find new ways to treat patients in real time. And so I think for whoever's coming in, if they just give us the same things around healthcare and miss the opportunity to include telehealth as an eligible service, we've missed the opportunity to reinvent and reimagine healthcare the same way we'll miss the opportunity to reinvent and reimagine education. So I think there's a lot of things that people need to look at, but I urge any candidate to think about technology no longer as 7th, but really as the A, the B, the C of every vertical that we're interested in the United States: transportation, energy, etc. It matters when people are connected.
Nicol Turner-Lee, we are almost out of time, but I want to thank you so much for joining us. Can you tell everyone in the audience how to reach you and where they can read more? I've read your article on the Biden-Harris ticket, and I'm looking forward to reading the next one. But what else can we, let the audience know how they can reach you, and anything else you might want to say?
So I'm on Twitter at Dr. Turner-Lee. You can find me there. You can find me at the Brookings webpage, Nicol Turner-Lee, no hyphen. And you can find me on the web. I've got a website where you could actually find all the stuff that I do, from stuff I do at Brookings to stuff I do for other partners like this. And that website is at, Dr. Nicol Speaks. I kind of went Oprah-esque. Decided to do something because there's so many, my name is so long, but if you do Dr. Nicol Speaks, Nicol without an E, you'll actually find me there. But please stay in touch. I welcome more conversation on questions, and I want to thank this organization for having me for this conversation.
So we definitely have to have you back to talk about Digitally Invisible, especially because you worked here right where I'm sitting, right in the heart of Hartford. So thank you so much.
Thank you.
And I'll just close out by saying thank you so much, Dr. Turner-Lee. It was an absolute joy and so informative to have you here. And thank you to everyone who joined in today in this discussion. If you want to revisit this discussion, as I know I'll be doing, you can head over to our YouTube channel at World Affairs Council of Connecticut. It'll be up there. You can check out all the prior episodes, especially this one. We do have a slight break in our episodes coming up, so we don't have one next week, but we do want you to stay tuned because we'll be having our annual Global Security Forum in late September and early October. And Dr. Turner-Lee, last year our keynote was John Allen, and I think I see his book right behind you right now as well.
Right. I would be a bad employee by his book. My boss, look, I moderated a panel with John Allen, the president of Brookings, and my boss, who's a co-author. It was a lot of pressure. It was a lot of pressure.
And I know it's going to be a really great global security forum, so we encourage everyone to stay tuned for more information on that. And in the meantime, thank you again so much, and we look forward to hopefully talking with you soon again.
Thank you. Bye.